Hi guys, this is Tiran here, and today we are going to talk about a global issue, mental health. Basically, there are 5 parts in this video. First of all, I'll guide you to learn about the basic concepts of mental health and mental disorders. We'll focus on schizophrenia and we are going to learn how to diagnose it, its treatment, and therapy such as CBT, with a summary at the end of this video. The term mental health means a person's condition with regard to their psychological and emotional well-being. In the aspect of clinical psychology, when we see the term condition, we need to realize there's a positive and a negative condition. The positive condition of mental health could be looking good, energetic, and active, but the problem is, what are the negative conditions of mental health? Here we go. We name them negative conditions as mental disorders. There are several categories under mental disorders such as mood disorders, psychotic disorders, and anxiety. Patients or people will act weird when they endure the stage of symptoms. It's an extremely painful experience for them all. Also remember there are many more types of psychotic disorders rather than these. We often see organizations like WHO, which provides research reports about depression and mental disorders. Results are mostly in crazy numbers such as estimated 300 million people are diagnosed with mental disorders worldwide in 2019. Of course, you may doubt those figures in the reports, but that's not our topic today. Now, let's move on to the psychotic disorder, schizophrenia. So schizophrenia is defined as a psychotic disorder which involves a break of reality in which the individual perceives the world in a very different way. It has 2 side symptoms, positive and negative. Positive represents an addition or distortion from normal experience, while the negative indicates the level of functioning drops below the normal levels. Now let's look up to a patient called Timmy. He was found drunk outside his house in Detroit and his neighbor called 911. The neighbor provided some detailed information about him. Number 1, his biological father was diagnosed to have schizophrenia. Second, he sometimes acts weird and he's also addicted to drugs and alcohol. Most importantly, when Timmy was 4 years old, his mother died of late cancer in a hospital. For the nurse's job, he needs to figure out the patient's condition by talking to the patient privately and analyze Timmy's detail given from the earlier phone call. Now let's follow his view and learn how a mental disorder is diagnosed.
Hello, sir. Do you want to go to the hospital, sir?
You know where's my mama?
No, I'm asking you whether you want to go to hospital and...
No.
You
just want to kill me.
No! Sir, we want to help you.
No!
Hey!
No!
Stop it!
No! In the beginning of this record, the nurse asked Timmy whether he wanted to go to the hospital or not. But Timmy asked, "Where's my mama?" instead, which we may tell he has some illogical thinking. Just now we have mentioned that any additional or distortion of behavior is counted as positive symptom, and that's how we diagnose as positive symptom. Remember that Timmy's mom passed away in his age of 4, so Timmy's childhood trauma was triggered, which correlates with his loss of mother, which further distorted his thinking. So he shouted out, "You just wanted to kill me," and tried to hit the surroundings. Now the nurse is able to confirm that Timmy is having a persecutory delusion, which is a specific type of schizophrenia. A persecutory delusion means that the individual thought someone is trying to harm him, which is the term the doctor will write on Timmy's profile, coming to the end of a diagnosis process. To help Timmy to recover from the schizophrenia, psychologist Aaron Beck invented a talking therapy called CBT, Cognitive Behavioral Therapy. It functions by helping patients to recognize and challenge their thoughts underlie their behaviors. Alongside CBT, antipsychotic drugs will also be used to help them to recover. And for a very long time, patients like Timmy, they are going to take this time to distort and rebuild their cognitions again. And this time could be taken for 10 whole years. And that's all of our video today. Let's take a recap on those key terms we have learned. We have mental health, positive negative condition, mental disorder, mood disorder, psychotic disorder, anxiety and schizophrenia, diagnosis, hallucinations, hyperactivity, delusions, thought disorder, persecutory delusions, and CBT as the final cap. If you enjoyed this video and liked the topic, please leave a like and comment or subscribe. I'll be making more videos like this in the future. Hope to see you again. Bye!